Hello everyone. Today I will present on visceral crisis in metastatic breast cancer. So we will have the definition first, and then what are the current guidelines and rationale? What is the evidence of CDK4/6 inhibitors in the present day for visceral crisis? And let's have summary and conclusions at last. What is the definition for visceral crisis? The ABC5 guidelines define visceral crisis as severe and rapid deterioration of visceral function due to infiltration by cancer cells. It specifically addresses each organ, liver dysfunction to the amount of bilirubin raised more than 1.5 times of the upper level of normal range. We should exclude the presence of Gilbert and obstruction in the scenario. Lung dysfunction amounting to dyspnea at rest, which is not relieved by pleural drainage. Presence of cytopenias due to marrow infiltration. And some also consider leptomeningeal disease as a part of visceral crisis. Nearly 10 to 15% of metastatic breast cancer patients present with visceral crisis. This is specifically important in the subgroup of HR positive, HER2 negative subset, because guidelines use visceral crisis as a marker for choosing chemotherapy over endocrine therapy. So, the present recommendation by guidelines is conventional chemotherapy for visceral crisis, even in the HR positive subset. This is mainly based on better and quicker responses with conventional chemotherapy. However, there are no trials that have specifically addressed response rates comparing chemotherapy and hormonal therapy, specifically in the subset of HR positive, HER2 negative. What all data we have are from the historical trials, where they have used advanced breast cancer patients unselected for HR positivity. And they've used anthracycline, cyclo, or taxane as the benchmark, or either alone or in combination, as the benchmark for response rates. And they report a response rates of around 40 to 45%. And they all have used the comparator arm as a weaker endocrine agent, that is tamoxifen or aromatase inhibitor. Well, all these historical trials are in the pre-CDK4/6 era. In the CDK4/6 era, the evidence what we have is the combination of CDK4/6 with endocrine therapy yields a response rates of nearly 50 to 59% in patients with measurable disease. So clearly, if you look into the numerical responses, the numbers, the combination of endocrine CDK4/6 has better responses in patients with HR positive, HER2 negative breast cancer. Well, let us look into what is the data for chemotherapy and what is the data for CDK4/6 in visceral crisis. Well, visceral crisis, we don't have a randomized trial. What all we have is a retrospective data. Well, this is a small retrospective study where this was in the pre-CDK4/6 era. They included 35 patients with HR positive, HER2 negative. And these were pre-treated with at least 2 lines of endocrine therapy before. And they used chemotherapy in these patients. And they reported an overall survival of just 4.7 weeks. And majority of these patients could receive only 1 cycle of chemotherapy. So the authors reported that there was no significant impact on survival in these patients. The best evidence for management of visceral crisis in the present day comes from a retrospective study of a real-world database. This included 336 patients with visceral crisis. 18% of them were treated with CDK4/6 inhibitor in combination with endocrine therapy. Well, the median overall survival was statistically significant, and it was better in the endocrine CDK4 arm versus chemotherapy. It was 11 versus 6 months. The 2-year overall survival was 26 versus 8%. So the authors concluded that using CDK4 inhibitor in combination with endocrine therapy in the frontline management of metastatic breast cancer with visceral crisis adds 5 months overall survival. Well, visceral crisis with liver dysfunction is a unique subset. It is unique because The conventional chemotherapy like anthracycline or taxane, which we use in this subset, we cannot use these in adequate doses or in full doses. This is because these are extensively metabolized in liver. Hence, we may have to use reduced doses, and therefore we cannot expect good responses even by using these drugs. Well, in contrast to conventional chemotherapy, you can safely use CDK4/6 inhibitors in combination with endocrine therapy, even in patients with liver dysfunction. Well, the prescribing information for the CDK4/6 inhibitor reads out that you can use this safely even in patients with child pug A or B dysfunction, and you can use reduced doses even in child pug C dysfunction. Well, in case of an endocrine resistant, heavily pretreated patient with hepatic dysfunction, you may use or you may salvage the liver with using platinum and 5-fluorouracil or fluoropyrimidines in this subset. Well, to summarize, treating visceral crisis is like a last-ditch effort to salvage the organ. What we need is rapid responses. And if your choice is not correct, and if the patient progresses, then you don't have the chance for second-line therapy. Therefore, you must choose the most effective and the least toxic regimen for these patients. Well, a compromised performance status and organ dysfunction are challenges to treat visceral crisis, and therefore they will not be able to tolerate full doses of conventional chemotherapy. Well, to conclude, visceral crisis is an oncological emergency. What you need is the most effective and the least toxic regimen. Well, the present guidelines that recommend conventional chemotherapy in visceral crisis is mainly based on historical data, which have used breast cancer patients unselected for estrogen receptor, progesterone receptor, and they've used anthracycline taxane chemotherapy regimen as the benchmark, and they've used a weaker endocrine therapy like tamoxifen or an aromatase inhibitor. All this data is in the pre-CDK4/6 era. Well, the best evidence for the management of visceral crisis in the present era, in the CDK4/6 era, is from a retrospective study of a real-world database that has reported a 5 months increment in overall survival. CDK4/6 inhibitor in combination with endocrine therapy have reported a response as good as 50 to 59% in patients with measurable disease. And these drugs can be safely given even in patients with liver dysfunction. So with this, I would thank you for patient listening.